So today we're looking at using the Connect sensor to improve medication adherence. In particular, focusing on supporting seniors in an independent living environment. This is a challenge for a number of people in the community, but in particular, seniors in an independent living situation, and we'll see that as we go along. But I think first off, to set the groundwork here. Um, this is a huge challenge in the healthcare community. Over $100 billion is the annual cost of non-compliance and non-adherence, people not taking their prescribed medications. And in particular, if we look at the average adult over 55, they're taking 6 to 8 medications daily. And again, looking at this graphic that came from, I believe, the Wall Street Journal, the first 2 points there, 49% forgot to take their prescribed medication, and 38% forgot they had taken a medication. So you can see that there's really a large percentage of folks that have issues either taking it or forgetting they took it. And what we're going to see with this application is that we can really, capture the fact that they did or did not take the medication, or at least we get much closer to that. So it's definitely an incremental improvement, and we think maybe an evolutionary improvement. So one of the things about using technology, though, with seniors is sort of this pushback on, well, seniors really don't either understand technology or embrace it, and I don't think that's true anymore. In fact, I looked at a number of statistics, and this is just one example where this was last summer, I believe. The fastest growing segment in social networking are people that are in that sort of senior category. So, while the total percentage might be, still relatively small, it's growing at a pretty rapid rate. The other thing we looked at things like cell phone adoption and tablet adoption, Kindles and iPads and so forth. And really, while I didn't take the time to present all of the statistics here, I think I do have one on the next slide, which talks to the Kindle demographics, and you can see from that in that dotted rectangle, there's a fairly large number of seniors, people over 50 certainly, that will put into that category that are using that product platform. So, and we looked at similar numbers with some of the other platforms as well, smartphones and so forth. So really, when you start looking at this from a more data-driven, if you will, basis, it's clear that seniors already do use technology. And the other thing that we're seeing is that boomers have grown up with technology, certainly in their business environment, and that we think that boomers are going to expect more and more technology support as they go into their into these senior living environments or independent living environments or those kinds of situations. So we think that's just a natural evolution there, which will further support demand, I think, for some of the products that we're envisioning. So, really, how big is the market? And I think if we look at that target population, I mean, clearly you can see the growth. Population over 60 in terms of millions. We're approaching 2015, and we're up in the 65 million range, and then as we go on out to 2020, 75 million. So, I mean, that curve is relatively steep. So we really haven't talked about what the product is yet, because I'm really trying to set the stage on what this market looks like. But the potential markets for the use of an application or an application-like product includes end users, obviously, but also managed healthcare organizations, both profit and nonprofit. We're also thinking about in the federal space, whether it's grant-driven or there could be a problem there in terms of public domain. So, we want to be able to obviously protect the IP, the intellectual property around that. But we also think that in the pharma space, both the manufacturers and the large pharmacy delivery organizations, drug management organizations, um, you know, represent a huge market as well for a product like this. So, one of the things we say is why is it so compelling? And number one, huge dollar impact. Another thing that we think using the Connect, when you actually see the demo, it's a cool factor. There's no doubt about it. And our let's say the proof of concept is pretty basic. I don't know that we need to put a lot of flash around that, but definitely it's a cool factor. And then we also see that using some other platforms for information delivery, and maybe as well as in some cases, maybe in the future interaction, platforms and tablets and smartphones are already in the community, and we sort of see those being integrated as well, because we think that ultimately the data that we're going to capture ideally would be going into into the cloud somewhere, maybe Health Vault, probably the best place to put it. So again, we're thinking that complementing and integrating the devices with the Connect sensor-based solution really provides additional capability. And of course, the population is growing dramatically. So kind of where is the market today with respect to other solutions in the space? And really, there have been a few, but there are a number of point solutions, a variety of gadgets and pill dispensers and so forth, but none of them really address the real issue. And another solution that has been covered in the literature was an automated call process that was actually evaluated here in Baltimore by Johns Hopkins. But again, very, very low tech, but fairly effective. And I think what we're looking at here is what we believe is that there are a variety of solutions, and not one solution is not going to address all the populations, all the issues. Another development we've seen over the last couple of years, a number of apps for Android and iPhones, and again, very much for the most part point solutions. Although there are some, there is some more integration now in the past year or two. Past year in particular, I think we've seen some more of the pharmaceutical companies and others in the distribution business. Pharmacy chains, for instance, beginning to deliver more integrated applications, but they typically are, a schedule, notify, and a response by the end user, and we, it requires that you're picking up a device to use it. So again, those might be good for some folks, but we think there's an opportunity for something more. And really, so the summary of the existing applications, some of them are somewhat intuitive, but they aren't really designed for the target population. The applications that we've looked at really not designed for the for the senior population. And the other thing that we kept looking at when we first started getting into this business, and I mean by business, looking at the market and looking at some solutions, that none of the solutions that we looked at could really independently confirm that somebody is taken the medication or taking the medication, either one. And what's so compelling about the Connect is, you have an image-based solution that really does, confirm the fact that somebody has administered that medication, taken the medication, either swallowed a pill or used an inhaler or whatever it is. So we really think that it's really addressing sort of the weak link that has existed up till now, and that is the actual end user taking the medication. So I guess the last bullet point really kind of summarizes that with the Connect, the entire process can be captured and verified. Um, so towards this end, the strategy is, we think, focusing on medication adherence is the number one uh, opportunity, and really see it as a market entree, if you will, into other things, but focusing on that event. We think that's huge. And then, looking at developing an engaging application, really engaging or enhancing or enabling rather stakeholder participation. It's getting late, um, and then really looking at ways to enhance the basic medication adherence to provide additional value. And then finally, and I think this is as important, the last bullet is really expanding the basic offering into a broader digital ecosystem, so that there's opportunities for a variety of interactions, including some of the social aspects, which some of that's starting to occur already in the healthcare community. But we think again there's even greater opportunity there. So um, in terms of monetization, the basic approach here is probably that the app is free, but obviously there's a sensor that has to be provided in some way, and we don't envision that being free. Um, but perhaps a subscription service would be one way to sort of mitigate the upfront investment of whatever the sensor might cost and so forth, and that might be a much more appropriate solution anyway. Obviously, advertising is always an option. Service fees and so forth. As we look at broader solution sets and greater integration um, of sort of the back end system, if you will, than other merchant fees or revenue sharing. Um, but in particular, things like oxygen suppliers and home cleaning services, and there's a whole raft of services that kind of complement the environment. So we do need to develop a data-driven business model. But at this point, we really scrambled just to get to the point of putting together a quick prototype that we could start to surface and get some reaction to. So finally, sort of next steps. The initial business model, we have a concept around that. We'd like to um, further enhance it, if you will, or provide some more structure around it. The current funding sources are internal. I mean, we really haven't invested a lot of money. There's been some time and so forth. Looking at trying to find some additional resources that can help develop the concept, if you will. And in particular, we have a couple of resources we're trying to develop in the academic and healthcare community here in Baltimore, as well as there's a fairly large retirement community that we're working on trying to get the right you know um, advisors, if you will, because we think it's really important to have folks from the both environments, both the academic side and in the kind of day-to-day retirement side, that can help us better evaluate and improve the basic prototype. So that's kind of where we are.